Supplementary A. Understanding the requirements of Clause 6 of ISO 15189:2022. Learning objectives. Following completion of this session, participants will be able to understand that the requirements of Clause 6 of the standard ISO 15189:2022, know what to do, have and look for in Clause 6 of the standard ISO 15189:2022. All text highlighted in red is the reference to the applicable clause of ISO 15189:2012. 6 resource requirements, 5 technical requirements, 6.1 general. The laboratory have adequate personnel, facilities, equipment, reagents, consumables, and support services necessary to manage and perform its activities. What did you have and look for in 6.1? Management review input, management output, minutes of management meeting, minutes of staff meeting, internal audit report. 6 resource requirements, 6.2 personnel, 5.1 personnel. The laboratory shall have sufficient number of competent persons to perform its activities. All personnel of the laboratory, either internal or external, that could influence the laboratory activities must be trained on impartiality and ethics. The laboratory must document an impartiality agreement. Staff must be trained and perform their activities in accordance with the laboratory's management system, continues. 6 resource requirements, 6.2 personnel, 5.1 personnel. 6.2.1 general, continued. The laboratory management must communicate to personnel the importance of meeting the needs and requirements of users as well as the ISO 15189:2022 requirements. The laboratory management must establish and implement a program, such as induction training, to introduce personnel to the organization, the department or area in which they will work. Does this program cover the terms and conditions of employment? Staff facilities, health and safety requirements, and occupational health services. 6 resource requirements, 6.2 personnel, 5.1 personnel. 6.2.2 competence requirements, 5.1.2 personnel qualifications, 5.1.6 competence assessment. The laboratory shall ensure that all personnel have the competence to perform laboratory activities for which they are responsible. Specify the competence requirements for each function influencing the results of laboratory activities. Specify the requirements for their education, qualification, training, retraining, technical knowledge, skills, and experience. Have a process for managing competence of its personnel. Assess and manage competence of its personnel. Include the method and requirements for frequency of competence assessment in the competency process. 6 resource requirements, 6.2 personnel, 5.1 personnel. 6.2.3 authorization, 4.1.2.5 responsibility, authority, and interrelationships, 5.1.3 job descriptions. The laboratory shall authorize its personnel to perform specific laboratory activities once they have been trained and deemed competent to perform an activity. Personnel for selection, development, modification, validation, and verification of methods. Personnel for review, release and reporting of results. Personnel for use of laboratory information systems, in particular, accessing patient data and information, entering patient data and examination results, changing patient data or examination results. 6 resource requirements, 6.2 personnel, 5.1 personnel. 5.1.8 continuing education and professional development. A continuing education program shall be available to lab personnel who participate in managerial and technical processes. All personnel shall participate in continuing education and regular professional development or other professional liaison activities. The suitability of continuing education programs and activities shall be reviewed periodically by the lab. 6 resource requirements, 6.2 personnel, 5.1 personnel. 6.2.5 personnel records, 5.1.9 personnel records. Personnel records may be kept in the lab or at the support department EHR. Copies of training and competency records should be kept in the lab. Records shall be available for position descriptions, training, and retraining. Competency assessments, monitoring of assessments, authorization documentation. What did you have and look for in 6.2? Current staff list procedure for personnel management, definition of internal and external personnel, procedures for position descriptions, job position/description and specification, procedures for training and retraining, training calendar, training records, training effectiveness report, induction training report, skills matrix, procedures for authorization of personnel, records of authorization, procedures for assessment and monitoring competence of personnel, competence assessment records, and report, impartiality and confidentiality agreement. 6 resource requirements, 6.3 facilities and environmental conditions, 5.2 accommodation and environmental conditions. 6.3.1 general, 5.2.1 general. The laboratory shall specify the requirements for facilities and environmental conditions necessary for the performance of its activities. The facilities and environmental conditions of the laboratory shall be suitable for its activities. The facilities and environmental conditions at pre-examination related facilities and sites other than the main laboratory premises, as well as POCT, shall be suitable for their activities. The specifications shall be monitored and recorded. 6 resource requirements, 6.3 facilities and environmental conditions, 5.2 accommodation and environmental conditions. 6.3.2 facility controls, 5.2.2 laboratory and office facilities, 5.2.6 facility maintenance and environmental conditions. The laboratory shall implement facility controls, record, monitor, and periodically review the facility controls, control the access to facility, take safety, confidentiality, quality, and safeguarding of medical information and patient samples when implementing access control continues. 6 resource requirements, 6.3 facilities and environmental conditions, 5.2 accommodation and environmental conditions. 6.3.2 facility controls, 5.2.2 laboratory and office facilities, 5.2.6 facility maintenance and environmental conditions. The facility controls shall include prevention of contamination, interference, or adverse influences on laboratory activities that can arise from energy sources, lighting, ventilation, noise, water, and waste disposal, prevention of cross-contamination. Where examination procedures pose a risk, or where work can be affected or influenced by lack of separation. Provision of safety facilities and devices, where applicable, and regularly verifying their functioning. Maintenance of laboratory facilities in a functional and reliable condition. 6 resource requirements, 6.3 facilities and environmental conditions, 5.2 accommodation and environmental conditions. 6.3.3 storage facilities, 5.2.3 storage facilities. The laboratory shall have storage space with conditions that ensures the continuing integrity of samples, equipment, reagents, consumables, documents, and records. The patient samples and materials used in examination processes must be stored to prevent cross-contamination and deterioration. The facilities for storage and disposal of hazardous materials and biological waste shall be appropriate to the classification of the materials as per applicable statutory or regulatory requirements. 6 resource requirements, 6.3 facilities and environmental conditions, 5.2 accommodation and environmental conditions. 6.3.4 personnel facilities, 5.2.4 staff facilities. To toilet facilities and supply of drinking water, to facilities for storage of personal protective equipment and clothing, to space for personnel activities, such as meetings, quiet study, and a rest area. 6 resource requirements, 6.3 facilities and environmental conditions, 5.2 accommodation and environmental conditions. 6.3.5 sample collection facilities, 5.2.5 patient sample collection facilities. The sample collection facilities shall enable proper collection of samples so that results are not invalidated or the quality of examinations is not adversely affected. Consider privacy, comfort, and needs of patients and accommodation of accompanying persons, guardian or interpreter, during collection. Have disabled access and toilet facility for patients, separate patient reception and collection areas. Have first aid materials for both patients and personnel and maintained in good condition. What did you have and look for in 6.3? Adequacy of laboratory and office facilities, facility maintenance, and environmental conditions records, adequate storage facilities, staff facilities, patient sample collection facilities, training and competency of persons monitoring and reviewing environmental conditions. 6 resource requirements, 6.4 equipment, 5.3 laboratory equipment, reagents, and consumables. 6.4.1 General, 5.3.1.1 General. The laboratory shall establish processes for the selection, procurement, installation, acceptance testing, including acceptability criteria, handling, transport, storage, use, maintenance, and decommissioning of equipment. These processes shall ensure proper functioning of equipment and prevent their contamination or deterioration. 6 resource requirements, 6.4 equipment, 5.3 laboratory equipment, reagents, and consumables. 6.4.2 equipment requirements, 5.3.1.1 General. The laboratory shall have access to equipment required for the correct performance of laboratory activities as listed on the equipment register. The laboratory management shall ensure that the ISO 15189:2022 requirements are met where the equipment is used outside the laboratory's permanent control or equipment manufacturer's functional specification. Each item of equipment that can influence laboratory activities shall be uniquely labeled, marked, or otherwise identified, a register of. Equipment shall be maintained in the laboratory. The laboratory management maintain and replace equipment as needed to ensure the quality of examination results. 6 resource requirements, 6.4 equipment, 5.3 laboratory equipment, reagents, and consumables. 6.4.3 equipment acceptance procedure, 5.3.1.2 equipment acceptance testing. The laboratory shall verify the conformance of equipment to specified acceptability criteria before being placed or returned into service. Equipment used for measurement shall be capable of achieving either the measurement accuracy or measurement uncertainty, or both. 6 resource requirements, 6.4 equipment, 5.3 laboratory equipment, reagents, and consumables. 6.4.4 equipment instructions for use, 5.3.1.3 equipment instructions for use. Does the laboratory have appropriate safeguards to prevent unintended adjustments of equipment? Is equipment operated by trained, authorized, and competent personnel? Are instructions for the use of equipment, including the manufacturer's instructions, readily available? Is the equipment used as per the manufacturer's specifications unless validated by the laboratory? 6 resource requirements, 6.4 equipment, 5.3 laboratory equipment, reagents, and consumables. 6.4.5 equipment maintenance and repair, 5.3.1.5 equipment maintenance and repair. The laboratory shall establish preventive maintenance programs based on manufacturer's instructions and recommendations. The laboratory shall record deviations from the manufacturer's schedules or instructions as per Justification E, G risk assessment. All equipment shall be maintained in a safe working condition and working order. Equipment should be provided with electrical safety and any emergency stop devices. The laboratory ensures safe handling and disposal of hazardous materials by authorized personnel. Continues. 6 resource requirements, 6.4 equipment, 5.3 laboratory equipment, reagents, and consumables. 6.4.5 equipment maintenance and repair, 5.3.1.5 equipment maintenance and repair. All defective or outside specification equipment shall be removed from service. Defective or outside specification equipment shall be clearly labeled or marked as being out of service, until it is verified to perform correctly. The laboratory examine the effect of the defect or deviation from specified requirements and initiate actions when non-conforming work occurs. The laboratory shall decontaminate equipment before service, repair, or decommissioning. When applicable, the laboratory shall provide suitable space for repairs and appropriate personal protective equipment. 6 resource requirements, 6.4 equipment, 5.3 laboratory equipment, reagents, and consumables. 6.4.6 equipment adverse incident reporting, 5.3.1.6 equipment adverse incident reporting. The laboratory shall investigate adverse incidents and accidents that can be attributed directly to specific equipment. Incidents and accidents shall be reported to either the manufacturer or supplier, or both, and appropriate authorities. The laboratory shall establish procedures for responding to any manufacturer's recall or other notice and taking actions recommended by the manufacturer. 6 resource requirements, 6.4 equipment, 5.3 laboratory equipment, reagents, and consumables. Records shall be maintained for each item of equipment that influences the results of laboratory activities. Equipment records shall include manufacturer and supplier details and sufficient information to uniquely identify each item of equipment, including software and firmware, dates of receipt, acceptance testing, and entering into service. Evidence that equipment conforms with specified acceptability criteria, the current location of equipment, condition of equipment when received, new/used/reconditioned, manufacturer's instructions, continued. 6 resource requirements, 6.4 equipment, 5.3 laboratory equipment, reagents, and consumables. Equipment records shall include the program for preventive maintenance, any maintenance activities performed by the laboratory or approved external service provider, any damage to, malfunction, modification, or repair of the equipment. Equipment performance records such as reports or either certificates of calibrations or verifications, or both, including dates, times, and results, status of the equipment such as active or in service, out of service, quarantined, retired, or obsolete. Are these records maintained properly and readily available for the lifespan of the equipment or longer, as per retention time for records specified by the lab? What did you have and look for in 6.4? Procedure for management of equipment. Procedure for equipment acceptance. Records of equipment acceptance. Procedure for responding to any manufacturer's recall. Equipment user manual. Equipment file. Equipment history records. Preventive maintenance schedule. Preventive maintenance records. Equipment verification records. 6 resource requirements, 6.5 equipment calibration and metrological traceability 5. 3.1 4 equipment calibration and metrological traceability. The laboratory shall specify calibration and traceability requirements that is sufficient to maintain consistent reporting of examination results over time. The specification for quantitative methods of a measured analyte shall include calibration and metrological traceability requirements. For qualitative methods and quantitative methods that measure characteristics rather than discrete analytes, specify the characteristic being assessed and the requirements necessary for reproducibility over time. 6 resource requirements, 6.5 equipment calibration and metrological traceability 5. 3.1 4 equipment calibration and metrological traceability. 6.5.2 equipment calibration, 5.3.1.4 equipment calibration and metrological traceability. The laboratory shall establish procedures for the calibration of equipment that directly or indirectly affects examination results. The equipment calibration procedure shall specify the following: conditions of use and manufacturer's instructions for calibration, recording of the metrological traceability, verification of the required measurement accuracy and the functioning of the measuring system at specified intervals, recording the calibration status and date of recalibration, ensuring that, where correction factors are used, these are updated and recorded when recalibration occurs, handling of situations when calibration may have been out of control. 6 resource requirements 6.5 equipment calibration and metrological traceability 5. 3.1 4 equipment calibration and metrological traceability. 6.5.3 Metrological traceability of measurement results 5.3.1.4 Equipment calibration and metrological traceability. The laboratory shall establish and maintain metrological traceability of its measurement results. Metrological traceability shall be maintained by means of a documented, unbroken chain of calibrations, each contributing to the measurement uncertainty, linking them to an appropriate reference. The laboratory shall ensure that measurement results are traceable to the highest possible order of traceability and as close as possible to the International System of Units, SI. The laboratory may ensure traceability of measurement results through calibration provided by an ISO/IEC 1725 accredited calibration laboratory. The laboratory may ensure traceability of measurement results through certified values of certified reference materials provided by an ISO 17034 accredited RM producer with stated metrological traceability to the SI. 6 resource requirements 6.5 equipment calibration and metrological traceability 5. 3.1 4 equipment calibration and metrological traceability. 6.5.3 Metrological traceability of measurement results 5.3.1.4 Equipment calibration and metrological traceability. Where it is not possible to provide traceability according to 6.5.3, any other means for providing confidence in the results may be applied. Traceability to genetic reference sequences shall be established for genetic examinations. Traceability shall be demonstrated for qualitative methods by testing of known material or previous samples sufficient to show consistent identification and, when applicable, intensity of reaction. What did you have and look for in 6.5? Procedure for equipment calibration, calibration status of equipment, calibration certificates, review of calibration certificates, in-house calibration procedures where applicable, in-house calibration records where applicable, training on interpretation of equipment calibration certificates. 6 resource requirements 6.6 Reagents and consumables 5.3 Laboratory equipment, reagents and consumables. 6.6.1 General 5.3.2.1 General. The laboratory shall establish processes for the selection, procurement, reception, storage, acceptance testing, and inventory management of reagents and consumables. 6 resource requirements 6.6 Reagents and consumables 5.3 Laboratory equipment, reagents and consumables. 6.6.2 Reagents and consumables receipt and storage 5.3.2.2 Reagents and consumables, reception and storage. Are reagents and consumables stored by the lab according to manufacturer's specifications? Does the lab monitor the environmental conditions of storage when the laboratory is not the receiving facility? Does it verify the storage and handling capabilities of the receiving facility to ensure supplies are maintained in a manner that prevents damage and deterioration? 6 resource requirements 6.6 Reagents and consumables 5.3 Laboratory equipment, reagents and consumables. 6.6.3 Reagents and consumables acceptance testing 5.3.2.3 Reagents and consumables, acceptance testing. The lab shall verify performance of each reagent or new formulation of examination kits with changes in reagents or procedure or a new lot or shipment before placing them into use or before release of results. The lab shall verify performance of consumables that can affect the quality of examinations before placing them into use. 6 resource requirements 6.6 Reagents and consumables 5.3 Laboratory equipment, reagents and consumables. 6.6.4 Reagents and consumables inventory management 5.3.2.4 Reagents and consumables, inventory management. The laboratory shall establish and document an inventory management system for reagents and consumables. The system for inventory management shall segregate reagents and consumables that have been accepted for use from those that have been neither inspected nor accepted for use. 6 resource requirements 6.6 reagents and consumables 5.3 laboratory equipment, reagents and consumables. 6.6.5 reagents and consumables instructions for use 5.3.2.5 reagents and consumables, instructions for use. Instructions for the use of reagents and consumables, including those provided by the manufacturers, shall be readily available at the point of use. Reagents and consumables are being used according to the manufacturer's specifications. 6 resource requirements 6.6 reagents and consumables 5.3 laboratory equipment, reagents and consumables. 5.3.2.6 reagents and consumables, adverse incident reporting. The laboratory shall investigate adverse incidents and accidents that can be attributed directly to specific reagents or consumables. The laboratory shall report it to either the manufacturer or supplier, or both, and appropriate authorities. The laboratory shall establish procedures for responding to any manufacturer's recall or other notice and taking actions recommended by the manufacturer. 6 resource requirements 6.6 reagents and consumables 5.3 laboratory equipment, reagents and consumables. 6.6.7 reagents and consumables records 5.3.2.7 reagents and consumables records. The laboratory shall maintain the records for each reagent and consumable that contributes to the performance of examinations. The records for such reagent and consumable shall include at least the following: identity of the reagent or consumable, manufacturer's information, including instructions, name and batch code or lot number, date of receipt and condition when received, the expiry date, date of first use, and, where applicable, the date the reagent or consumable was taken out of service. Records that confirm the reagents or consumables' initial and ongoing acceptance for use, the laboratory that used reagents. Prepared or completed in-house shall maintain records including reference to the persons undertaking the preparation, as well as the dates of preparation and expiry, in addition to the above. For in-house preparation records shall include reference to the persons undertaking the preparation, as well as the dates of preparation and expiry, in addition to the above. What did you have and look for in 6.6? Procedure for reception, storage, acceptance testing, and inventory management of reagents and consumables, records of reception, storage, acceptance testing, and inventory management of reagents and consumables, records of inventory management, instructions for use, adverse incident reporting, acceptance testing, reagents, and consumables records. 6 resource requirements 6.7 service agreements 4.4 service agreements. 6.7.1 agreements with laboratory users 4.4.1 establishment of service agreements. The laboratory shall have a procedure to establish and periodically review service agreements for providing laboratory activities. The requirements for providing laboratory activities adequately specified in service agreements. The capability and resources to meet the requirements. Advise the user of the specific activities to be performed by referral laboratories and consultants. Inform users of any changes to an agreement that can affect examination results. Review service agreements, including any significant changes and retained records. 6 resource requirements 6.7 service agreements 4.4 service agreements. 6.7.2 agreements with PUCD operators new. The service agreements with PCD operators shall ensure that specific responsibilities and authorities defined and communicated. What did you have and look for in 6.7? Procedure to establish and periodically review agreements for providing laboratory activities, records of review of requests, request for examination including PUCT. 6 resource requirements 6.8 externally provided products and services 4.6 external services and supplies. The laboratory shall ensure that externally provided products and services that affect laboratory activities are suitable when they are intended for incorporation into the laboratory's own activities, provided, in part or in full, directly to the user by the laboratory, as received from the external provider, used to support the operation of the laboratory. The laboratory shall collaborate with other organizational departments or functions to fulfill above requirement. 6 Resource Requirement 6.8 Externally Provided Products and Services 4.6 External Services and Supplies. For point 5 Examination by referral laboratories. The laboratory shall communicate its requirements to referral laboratories and consultants who provide interpretations and advice for the following: the procedures, examinations, reports, and consulting activities to be provided, management of critical results, any required personnel qualifications, and demonstration of competence. The referring laboratory is responsible for ensuring that examination results of the referral laboratory are provided to the person making the request. A list of all referral laboratories and consultants shall be maintained in the laboratory. 6 Resource Requirement 6.8 Externally Provided Products and Services 4.6 External Services and Supplies. 6.8.3 Review and Approval of Externally Provided Products and Services. For point 5.1 Selecting and Evaluating Referral Laboratories and Consultants. The laboratory shall have procedures and retain records for A. Defining, reviewing, and approving the laboratory's requirements for all externally provided products and services. B. Defining the criteria for qualification, selection, evaluation of performance, and reevaluation of external providers. C. Referral of samples. 6 Resource Requirement 6.8 Externally Provided Products and Services 4.6 External Services and Supplies. 6.8.3 Review and Approval of Externally Provided Products and Services. For point 5.1 Selecting and Evaluating Referral Laboratories and Consultants. The laboratory shall have procedures and retain records for D. Ensuring that externally provided products and services conform to the laboratory's established requirements, or where applicable to the relevant requirements of this document, before they are used or directly provided to the user. E. Taking any actions arising from evaluations of the performance of external providers. What did you have and look for in 6.8? Procedure for externally provided products and services, procedure for selecting and evaluating referral laboratories and consultants, purchase order, purchase requisition, approved supplier list. Approved referral laboratories and consultants list supplier approval form, referral laboratories and consultants approval form, acceptance records. Thank you.